We think it's transmitted by close contact, intimate contact, so sexual contact, skin-on-skin contact, kissing, open mouth kissing in particular. So those types of exposures is what we're seeing when we've talked to people who have monkeypox that talk about their risk. Right now, it appears to be that people who have had close contact with someone with confirmed monkeypox or lesions, skin on skin or sexual contact. And so if you're in a venue where there's a lot more potential exposure, where there's a lot of skin on skin contact. So some of the initial outbreaks in the UK were at rave dance parties where people were shirtless, not fully dressed, that had skin-on-skin contact with multiple individuals or sexual contact with multiple individuals that increase their risk of exposure and acquisition. There are certain individuals may be at higher risk if they have immune compromising conditions, so if their immune system is not as strong for whatever reason, related to underlying diseases or medications they're on. And pregnancy is also a relatively immunocompromised state, so those individuals may be at higher risk for getting more severe disease. That said, this type of monkeypox virus, this clade, is associated with less mortality, which is good, and most individuals have self-limited disease. Many individuals have self-limited disease, but if you have painful lesions or if you have multiple lesions throughout your body and are experiencing systemic symptoms, it is worthwhile to discuss with your provider about getting tested for monkeypox first, and then if that's positive, to get a referral for treatment if you meet one of those conditions like pain or numerous lesions. So here at UW Medicine, we are offering testing. Many of our primary care clinics are doing testing. Call your provider, message your clinic, let them know you're concerned about monkeypox so that they can let you know about the proper precautions to take before coming into clinic. And they can swab those lesions and send it for testing. If there is a concern for a need for treatment, we do have options for referrals for treatment. We have a few clinics that are offering, and we are ramping up those clinics and providers as well. For most of our patients, they'll know within 24 hours if they have monkeypox. It's an antiviral medication. It was FDA approved for use for treatment of smallpox, actually, based on animal data. Because it is considered an investigational new drug, it is only available through the CDC, and it's been allocated to states and then local health jurisdictions. And so it's not the type of medication where your doctor can just prescribe it and you can pick it up at your local pharmacy. There are specific places in our community and specific providers that are allowed to prescribe it at this time. Those number of prescribers and the locations for this therapy are expanding, but currently it is still limited. It's called Jynneos, and it is a 2-dose vaccine, but right now, given the limited supply, we're really prioritizing those first doses in the supply that we have, and then as supply increases, that second dose will be available. It is a 2-dose series, dosed 28 days apart at a minimum. If you have come in contact with someone who has monkeypox and you're very concerned about that exposure and you're within 2 weeks of that exposure and have no symptoms at all, then you are eligible to receive that vaccine. If people are concerned about an exposure or concerned that they're at risk and want to be considered for the vaccine, we have a few clinics that are already doing this, but we want people to work with their providers, their primary care providers, as we are ramping up our vaccine efforts currently to be able to accommodate many more patients and offer vaccine on a broader scale. I want to say that there's some key important differences. The COVID is highly transmissible in a way that monkeypox is not. And not to say that monkeypox isn't transmissible, the type of contact and the type of exposure is quite different. For COVID, you go to an event, a public event, chatting out, at a restaurant, eating at a restaurant, those are exposures. That's not the type of exposure we're talking about here with monkeypox. We're talking about much more intimate exposures, definitive contact exposures. So it's very different.